Hello, my name is Alicia Larry Lewis, and I'm going to be talking about Chapter 14 and Chapter 15 of our textbook. Chapter 14 discusses the psychological disorders, and Chapter 15 goes over the psychotherapy, the method, the background of psychotherapy. But first, we're going to talk about disorders. And what I learned was there are three criteria for deciding whether or not someone has a psychological disorder. And the first criterion is having deviance. Deviance is when someone is acting outside of their normal behavior. This could go into cultural norms. When someone is acting weirdly or unusually, someone will probably depict them as having some kind of strange frequency or just having a disorder. And that's how people would claim them to be different, if you will. And then the next criterion is personal distress. It's when you are in anguish, when you're suffering or being tormented by something. You're just anxious all the time, extremely anxious. And then the third criterion is maladaptive. And this one kind of confused me a bit because all the examples were leading to certain types of being or inability of adapting to culture or adapting to changes in people's lives. And apparently, this comes from when like a person experiences a huge change or a huge situation, challenge that makes them have to choose either fight or flight. And whenever they can't get past this situation, they start to go into different coping mechanisms like smoking or drugs, all that good stuff. Not really good stuff. And I also learned about the DSM-5, which is a book that goes into the different psychological disorders that could be had by people. It's a huge purple book, and I've seen it before because my mom has one, and she's a social worker. So I've never read it. I actually could take advantage of it because I have it, but I've never read it before. But this is the book that therapists and other doctors who prescribe medication or who work with clients through treatment read the book. So that's what I learned. And there are quite a few disorders. I can't remember them all, so I wrote them down. And they were all categories, and these are the categories. You have anxiety disorders, you have depressive and bipolar disorders, you have schizophrenic disorders, you have autism spectrum disorders, schizophrenic disorders, and eating disorders. These are all pretty popular because people experience them all the time, and mental health is starting to become more mainstream and talked about. So I wrote most of my notes about anxiety disorders because it was the largest category. Not to minimize the other categories of the disorders, but this was the largest one that I came across. And apparently, OCD, which is obsessive compulsive disorder, used to be a part of the anxiety disorder category umbrella. However, in the DSM-5, which I didn't say, no, yes, I did, excuse me. But in the DSM-5, the OCD used to be a part of it, but it changed like maybe a decade ago and is now a category of its own. And there was a lot of controversy with OCD because people typically joke around and say that they have OCD from cleaning up things or having a desire to organize their items in a particular way. And that can be confusing for people who don't have OCD because OCD isn't just about having the desire to change things into a particular manner. OCD people have not just a desire, but like a need to do things like make certain things happen in order for them to feel like calm and secure. and it can get into a very extreme, what is it called? Not an addiction, but I forget the terminology. But it's different for people who actually experience and suffer from OCD disorder. So just thought I would throw that in there. And next, what I learned from the anxiety category was that classical and operant conditioning are what they stem from typically. Although anxiety is like a genetic disorder, people can be like introduced to it by having some kind of situation occur to them when they're a child, and then a continuing like behavioral, like operant conditioning. And we learned about classical and operant conditioning way back when in our textbooks. And there's a difference between classical and operant. Simply, classical is when you have involuntary and what was the other one? Involuntary and a stimulus. And there was a scientist who had this experiment that involved dogs and a bell, and whenever they would like ring the bell, the dogs would start salivating because they knew that that was when they were getting their food. And there are different factors that go into what the brain can remember if it's repetitive and consistently done over time. And operant involves some type of like behavior and a consequence, like a reward or like a punishment. And this could be done like an example of this could be done with a teacher in a classroom, and the teacher having good like wanting the students to portray good behavior and having a reward for those who do good in the classroom or make good grades on a test or turn their homework in on time and other things like that. Just having a reward system for it. But that was all chapter 14. There was a lot more that I just cannot fit into this video. So very shortly I will discuss chapter 15, which is again psychotherapy. And there are 3 parts that go into psychotherapy, which is where you have a therapist giving treatment to a client. That is the premise of psychotherapy. And there are 3 types of psychotherapies, if you will. There is insight therapy, there's behavior therapy, and then there's biomedical therapy. Oh my gosh. Biomedical therapy. I'll start with insight therapy. Insight therapy is talking, but that's also behavior. But instead of focusing just on finding the solution to the problems a client is having, you're also talking about why or like how the client is getting into these problematic situations. What's the cause of it, or what it is, like what is their difficulty, and then allowing some communication and complex questions to be involved with the therapy, and then going into solutions, trying to find possible solutions to their problems. And then behavior is trying to change the behavior that causes these problematic situations to occur, along with like problem solving, like finding out solutions. And then you have biomedical, which is where you're trying to deal with the person's physiological functioning. And there were two factors that went into this. There was drugs. That sounds like bad, but they're like prescribing drugs. And then also electroconvulsive therapy. And that's all. Thank you.